Hello everybody, so I hope you all are doing good. We are going to start a new series of videos in which we will be talking about different types of conjunctivitis. So before moving on to the particular types of conjunctivitis, I will first like you to know what are the classical features associated with different types of conjunctivitis so that you will be able to make diagnosis. Okay, remember one thing, every conjunctivitis has some classical characteristic features associated with it. Okay, so start with basics of conjunctivitis. Okay, so what is conjunctivitis? Conjunctivitis is simply the inflammation of the conjunctiva. Okay, so how to know whether the patient has conjunctivitis, or what will be the presenting features that suggest the patient has inflammation of conjunctiva? Remember, the patient will have foreign body sensation, there will be irritation or itching. Okay, now I would like to mention one thing here. Irritation or itching, particularly itching, is the classical feature of allergic conjunctivitis. Okay, remember this now. If someone has the presence of severe itching, and then there is a history that it varies with season, okay, and then when you examine, you have some classical characteristic findings on examination. I will tell that in a while what are the classical examination findings of allergic conjunctivitis. So itching and history of that, it is seasonally variable. Okay, so this is allergic conjunctivitis. One important point, itching is the classical feature. Profuse itching, severe itching is a classical feature of allergic conjunctivitis. Then the patient will have characteristic type of discharge. Okay, let's talk about different kinds of discharge here. If the patient has mucopurulent discharge, remember this is your bacterial conjunctivitis. If the patient has watery discharge, this is most of the time associated with viral conjunctivitis. If the patient has ropey discharge, this is VKC, viral keratoconjunctivitis conjunctivitis. Okay, this is actually an allergic reaction, allergic conjunctivitis. Okay, then conjunctival chemosis. Now, what is conjunctival chemosis? Conjunctival chemosis is simply the swelling of the conjunctiva. This is the conjunctival chemosis. Okay, you can see, I hope that this is the swollen conjunctiva. Okay, conjunctiva is swollen, and you can see that it's actually bulging outwards. Okay, so conjunctival chemosis can happen, and this can happen with any of your bacterial conjunctivitis, your viral conjunctivitis, or your allergic conjunctivitis. Anything can have this allergic chemosis. Okay, now if the patient complains of pain, okay, remember that cornea is also involved with conjunctivitis. Okay, usually conjunctival inflammation doesn't cause pain, but if the pain is also associated feature, then remember that cornea is also involved, and then there will be blurring of vision. Okay, so first picture has been discussed. This is conjunctival chemosis, and it can happen with your bacterial, viral, or allergic conjunctivitis. This is simply the edema of the conjunctiva. Okay, so this is mucopurulent discharge, and this is a pink eye. Actually, you can see that there is erythema, there is diffuse swelling, and then there is somewhat like mucopurulent discharge. Let me zoom this out so that you can see it clearly. So this is the mucopurulent discharge. Okay, so this is most probably bacterial conjunctivitis. Okay, so what is the classical feature of bacterial conjunctivitis? I told you that there will be pink eye, there will be mucopurulent discharge, and then the patient will be complaining that when the patient wakes up in the morning, eyelashes are often matted together, and that suggests that there is mucopurulent discharge, which when dries up leads to matting of the eyelashes. Okay, this very important feature of viral conjunctivitis. These are your follicles. Okay, diffuse small swellings present on your palpebral conjunctiva in this picture are your follicles. Okay, so what are follicles? If I ask the composition of follicles, you should know that follicles are composed of lymphocytes. These are round aggregations of lymphocytes, and you know that lymphocytes are active in your viral infections rather than your bacterial infection, because in bacterial infection neutrophils has a major role, okay, and in viral infection your lymphocytes have a major role. So remember, if someone has the aggregates of lymphocytes, means follicles, so this is the characteristic feature of your viral conjunctivitis. So what are the other features associated with viral conjunctivitis? Remember, watery discharge, okay, watery discharge, and there will be the history that many of the patient's family members are affected, or the patient's friends are affected, colleagues are affected. So viral conjunctivitis is contagious, and follicles, watery discharge will be present. Okay, this is very important. Okay, so what are these? These are papillae. Okay, so what are papillae? Let me draw here for you. Okay, papillae are composed of fibrovascular core covered with epithelium. Fibrovascular core. Fibrovascular core has fibrous component, that is the connective tissue. Okay, fibrous connective tissue, and the vascular component. So some vessels. So this is core, and this core is surrounded by your epithelium. Okay, so if you just see them, see these papillae under microscopy, you will see this. Okay, there will be fibrovascular core. Okay, this is the fibrovascular core. This is the fibrovascular core composed of fibrous component, that is a connective tissue, and vascular component. So fibrovascular core that is covered over by epithelium. So papillae. Okay, so in this picture, papillae are present on the palpebral conjunctiva, and the characteristic pattern is known as copperstone pattern. Okay, so these are the characteristic feature of your allergic conjunctivitis. Remember this thing. If you find someone having papillae, remember this is seen in your allergic conjunctivitis. So what are the other symptoms associated with allergic conjunctivitis? There will be severe itching that I told you before. There will be severe itching. Okay, then there will be lacrimation, foreign body sensation, and blurring of vision that is associated with other conjunctivitis as well. Okay, but thick mucoid ropey discharge. Okay, thick mucoid ropey discharge, and your papillae, and the history that the patient has this condition which varies with season. Okay, or on the exposure to particular type of substance. So severe itching, ropey discharge, papillae, and the history. These all suggest that the patient has allergic conjunctivitis. So this was it for the video. In the next video we will be starting with bacterial conjunctivitis and moving on to the viral conjunctivitis and then allergic conjunctivitis. So if you like this video, kindly subscribe to the channel because it motivates me to make more of such videos, and best of luck.